Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. Welcome to episode number 8 of the MotherWit podcast. Oh, and a gentle reminder that nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your health care.
You just kind of randomly hit record. We didn't have a plan. And
Yeah.
we had this great conversation, and then you just aired the whole thing, and it was great. And I was like,
It was so great. That's like one of my highest listened to podcast episodes.
well, and it's pretty awesome because people actually still reach out to me from that. So I'm like, okay, you had made a good push for my services a long time ago, and that was amazing. And then that podcast that was kind of just so off the cuff and happened so organically just continues to be this great thing that people find, and that's how they find me. And it's been so wonderful. And I was like, I'm going to play the same little trick with you.
Yeah. Yeah. I mean, might as well, like it did so well the first time.
My guest today is Liesel Teen, better known as Mommy Labor Nurse. Liesel and I first met when I was working for a small startup that was all in on maternal health, specifically postpartum care. Liesel was one of our biggest supporters. She promoted us to her audience when she was pregnant with her second baby. She signed up for our program. And so I got to spend a lot of time with Liesel, and I got to know her fairly well. You've heard the stories now of 3 early pandemic MotherWit mamas that I was caring for, and perhaps you noticed a trend. They all mentioned Liesel. Either her courses, I should say, her podcast, and of course her Instagram feed. So today, I'm going to take a break from the heavier stuff. I hope you enjoy this conversation with Liesel Teen.
Hi, Liesel. It's so nice to
Hi.
connect with you.
So nice to chat with you, Tanya. I mean, it's always a pleasure.
I'm really looking forward to just chatting with you today. And, maybe we'll veer down some roads where it maybe gets a little heavy. Maybe it won't.
Yeah.
It'll be super off the cuff because I know that my listenership, despite it being small, they all know you and they all love you. And I know that because you have literally gotten a mention on every single episode where
Aw.
I've interviewed a client.
Love it.
They
Aw.
all say they found me from you, or they took your course, or this or that. Like it just every single one. And I've just been giggling and I've been like, all right, it's time to have Liesel back on.
Aw, I love that. Well, I'm honored to be here with you, Tanya.
Thanks so much. So how are you? Just give me the blow by blow on how life's been since we spoke last.
Good. I mean, I feel like I'm doing, honestly, the best that I've been doing in a really, really long time. So I mean, when was the last time I talked to you? I don't think I'd moved into this house yet, but all set up in our new house. The kids are getting a little bit older. My older one's about to turn 5, and Rylan's he's about to turn a year and a half. So he's a little bit more independent now. Walter is Walter. I mean, he's 5, so he's more independent. We kind of got the school situation figured out and the childcare situation figured out. Right now, it's a little bit because we had a snow day. We've had snow days the past couple days, and obviously the COVID thing going on with I feel like everybody has COVID right now, and just everything is haywire. But other than that, everything's going really, really well. I've been on this for the past month or so now. I've been on this I don't even know what to call it, but self-exploration journey. And I've been getting up before my children wake up in the morning. And I've never, ever done that before. I've always been the kind of person that I want to sleep. Like, I value my sleep so much, but I've always been a horrible sleeper. So I've always been very intrigued by those by those people who get up before their children and they're like, I swear by it. It's so great. I have the me time, and then I tend to my children, and I'm like, that sounds great, but like, are you crazy? Like, why would anybody do that? Like, why would, no. So I gave it a shot, and I read this book called The 5 a.m. Club, and it was just all about how, you get a morning routine is, so important, and getting up. He didn't really talk about like the children aspect, but like getting up in the morning and having a morning routine and how important that is to like how it sets your whole day up. So what I've been doing is getting up, and sometimes it's, 5:15, 5:30, but get up. Immediately when I wake up, I do some sort of movement. Sometimes I hop on the Peloton. Sometimes I've been really into yoga lately because that just is what's been feeling really good. So do 20 minutes of exercise, and then I do 20 minutes of like reflection. So sometimes I have my journal in front of me, and sometimes I just sit there and meditate. I usually have my coffee in front of me, so I like make I drink black coffee, so I make my coffee before I work out, and then it's like the perfect temperature to drink when I'm in my 20-minute journal, meditation, whatever I decide to do. And it is crazy, Tanya, some of the thoughts that come to me when I'm in this 20-minute session, because it's been 5 years that I've had children, and there's not very many times in the day where I'm just it's quiet. I don't have a purpose for like what I'm thinking about right now. There's not a distraction. So like this 20 minutes, I thought this 20-minute time chunk was going to be, because it's so the book, the book, what they talk about is 20 minutes of exercise, 20 minutes of reflection, 20 minutes of learning. And so learning is like you listen to a podcast, or you read a book, or you practice an instrument or something. Usually what I do during the third part is I hop in the shower and I listen to a podcast. But I thought that second part was going to be really, really hard for me, because I'm like, it just sitting there, like that just seems really hard. But oh my gosh, that's my favorite part because I just literally get to sit there and just like think. It's so great. So I've been doing that for about a month now, and it has drastically improved my mental health and just everything. I'm so obsessed with it. So I've told my audience about it, and I'm like, I know you guys are like new moms, and I do not want you to like sacrifice your sleep just to get up before your baby wakes up, because I will say sometimes Rylan still screams out in the middle of the night, or Walter the other night, he was like going potty in the middle of the night, and he came and woke me up because he didn't have any toilet paper, and I went upstairs and got him toilet paper. And I'm like, if I get up in the middle of the night, then I do not wake up at 5 a.m. I still try to do a little bit of a morning routine, but like I don't sacrifice this just to to meet my this high crazy expectation. I only get up at 5 a.m. like when I want to get up at 5 a.m. So
you are totally singing my song, right? So when I finally start working with people, especially when it comes to fitness stuff, one of the first speeches I give them is, this is not all or nothing. If you have an unexpected bad night, it's okay to do one of three things. Say, screw it, I'm not exercising today. Okay, maybe I'm going to go for a walk or just do yoga. Or maybe I'm going to do the workout I was going to do, but I'm not going to push myself hard. Or if you have a good night, then, and you were going to push hard, then you can. But I think you can apply that to any conversation. So I'm glad that you just said
totally.
That. You
totally
also just brought back a memory that I will now share with our listeners of something I did when I had little kids that sounds a little like the moment in time that you're in. Little kids, I said plural, I only have one kid. But there's this book that came out, I don't know, it might have come out when I was a young child. So, it was kind of an old book when I learned about it. It's called The Artist's Way. And it was written by someone named Julia Cameron. It's kind of cheesy in that
I like cheesy.
There are some really beautiful things, and I think it works for some people, and some parts of it work for some people and not others. But I have no regrets about doing this one part of the book, and I think other parts will work for some people. But anyway, it's called The Artist's Way. And the book was written for artists who were kind of having a moment where they were maybe just not progressing. They weren't doing well at their art form, whatever that may be. Writer's block, whatever, right? And so one of the tasks that is kind of the cornerstone of the book is called morning pages. And what she tells you that you have to do is wake up in the morning and pretty quickly, like you can make coffee. That's, the extent of the tasks you're allowed to do before you sit down. You put on a timer. It was probably something like 20 minutes, like what you're saying, but I don't remember the exact time. And you write like a stream of consciousness. You don't write with intention. You don't write because you're trying to write a novel, a story, have anyone ever read it. It doesn't matter if some days you literally write the same sentence 500 times. It doesn't matter if what you write doesn't make sense. It just, none of it matters. And what I learned in this time was that, and I've never reread what I wrote. I still have it. I've never looked at it. I'm terrified to do so. But I know that some mornings, like I would find myself crying while writing. And other mornings I would find myself giggling at whatever weirdness came out onto the paper. But what I can say is that for the number of months I did this, and at this point, all these years later, I can't remember whether I did it for 3 months or 6 months, but it was probably somewhere in between. It freed me up the whole rest of the day to be my best self. And it was so effective. Other parts of the book that are why I said it was corny is because it's kind of like, take yourself out on a date. And she gives you all these suggestions and there's just tons of interesting things. And I would read over them and think, oh, that actually sounds fun. I'll do that sometime. And then when push came to shove, I could never make myself do it. It felt so corny. I couldn't do it. But the morning pages part was worth every penny I spent on that book.
Cool. I'm definitely going to check it out. I've been really into those types of books. I've read a few like not self-help, but self-betterment, I guess, books. And that sounds like one of them. So I'm definitely interested in that. Yeah, it's crazy. So the other big thing that's happened recently is I recently got diagnosed with ADHD as an adult. And that's also been life-changing. I just started, I'm in medication management, but that's been life-changing because I'm like, I feel like this is why sometimes I feel like I have a lot of anxiety and sometimes I feel really depressed and sometimes I feel like I'm just kind of all over the place, and why I struggle a lot of times at this desk job what a lot of the time I do at Mommy Labor Nurse is I have tasks that I have to complete. It's very different from being a nurse, and you always have to be on, when you're nursing because you're caring for a patient, and it's, highs and lows. And when I'm doing stuff for Mommy Labor Nurse, I'm sitting here, and if I get really excited about something, then I'll, go head first into it. But if I have something that I'm not super excited about, it takes me so long to get started. And then when I finally do it, I'm like, okay, it's not that hard. Or I just get I've always been like so distracted with stuff, but it's actually crazy because with the ADHD, it's very cool to me now that I'm doing this 20-minute journaling, reflection in the morning. And it's crazy to me to see how fast my thoughts go from like one side of my brain to the other, So yeah, it's been very like just enlightening. I mean, I feel like in a lot of ways, I feel, it's very like emotional to think about, wow, I'm finally like, this is what's been going on in my brain for this long. And it's been called anxiety or depression. I mean, I definitely think I had postpartum anxiety and depression when I did. Like that was a form of postpartum, mental, I had a postpartum anxiety. But have I always had generalized anxiety like my doctor has told me, or these bouts of depression? I don't know. And I'm like, wow, I'm reading all this stuff about, women getting diagnosed later in life and it, being called anxiety for so long, and just like putting together, watching videos of people like describing what their ADHD is like. And I'm like, oh my gosh, I do that. I'm like I saw a video the other day of someone being like describing stimming and what stimming is. And, stimming is like when you're doing like you're, tapping your leg, or you're like bouncing your foot, or you're, playing with something, or nail biting or something like that. And one of the things that they said was biting the inside of your cheek. And I'm like, oh my God, I'm literally always biting the inside, like not when I'm talking, obviously right now, but if I'm like concentrating on something, it's like I get like canker sores in my mouth because I'm like constantly biting my cheek, and I'm like, oh my gosh. And it's just all of these things that I've just been reading and seeing over, the past. I only, talked to my psychiatrist a month ago and got diagnosed, and it's just been, it just feels like the perfect time now that, I've been in this like self-exploration time period, and it just kind of came at the perfect time. So it's really crazy. I've been taking Wellbutrin along with my Zoloft, because Wellbutrin is supposed to be off-label, helps with ADHD symptoms. So he was like, let's start you on this first and see if, this is working. And I've been on it for a month now, and I don't really feel it's helped the ADHD, but it might be a good, like, I like it with the Zoloft. Like, I feel like, the effects of the Zoloft have been like enhanced by the Wellbutrin. So, but I see him next week, so I'm going to talk to him more about medication management. But yeah, that's the other big thing, is that I got diagnosed with adult ADHD, and it's just really changed my life in a lot of like really, really great ways.
Well, that's huge, but you've made me think two thoughts. And that is, one is, I think this female adult ADHD diagnosis is a little like, how women have different symptoms when they're having a heart attack than men. I think there's a little bit of that going on. I also think, though, we've been dealing for centuries with, the medical establishment and men in general thinking we are, quote, hysterical, i.e. hysterectomy, all of that stuff. Yeah. So I think there's like long-term cultural piece that's coming up against understanding that diagnoses look really different in men and women. But I actually want to ask you, so what was it that happened? Like, how did this aha moment come out of nowhere? Like, what happened?
Yeah. No, it's crazy because I've been talking to I've been seeing the same therapist for 3 or 4 years now. And I've always kind of toyed with her. Like, I'm like, I know there's like something going on with my brain, but I've kind of just been too busy to like really dive into it. I'm like, I feel like maybe I have like a learning disorder or something, or maybe I have, maybe this is anxiety and I need it. I've always been talking to her about other things that have been going on in my life, though, and never really like honed in on this, what is going on in my brain completely. So I finally was like, you know what, Amy, like, I think I can't remember. I saw some post, and because my husband has ADHD, and I saw some post, and it was like describing something that I do. Like, I honestly can't even remember what it was, but it was like describing something that I do. And it was talking about ADHD. And I mentioned it to my therapist, and I was like, yeah, I don't know, ADHD, like my husband has ADHD. Sometimes he's really hyperactive and he just kind of goes all over the place. I was like, I've never really thought that that's me, but this inattentive piece to it, yeah, maybe I do kind of resonate with that. And I was like, I mean, is it a really hard thing to get tested for? So she was like, no, you just go see a psychiatrist and they'll ask you a bunch of questions and do a screening. It takes a few hours. And she was like, it's really can be very life-changing if you get on the right medication management. And so then I took some Adderall of my husband's during the day, not Nurse Liesel is saying that, but I took an Adderall of his. Yeah. But I took one of his Adderall during the day, just, and I was like, this is very different. I was like, I'm not like shaking, it's not like I drank like 50 cups of coffee or anything, but the difference in like, I could remember the first task that I was like starting to do something. Like I can't remember what I was doing. Again, very forgetful. That's another like thing with ADHD. You're just very forgetful. There's just a lot going on in your brain, and just like things come in and come out. So I was like performing it. I think I was packing my child's lunch in the morning, and I always remembered that I was packing his lunch. Like I never like. That's the thing that happens is like I'll start something and then I'll see something over here. I'll be like, oh, let me go clean that really quick. And then I'll eventually usually remember what I was like first doing, but it takes a while. But yeah, when I took that Adderall that one day with my husband, of my husband's, I always remembered that I was like on his the packing of his lunch, and I could choose if I got distracted by, the toy that needed to be picked up over here, or something that my husband said, or but I knew the task that I had to do. It was just the craziest. I'm like, is this how normal people are? I don't know. So
I'm still trying to figure out what normal means, right?
I know. There is no normal, really. There is no normal.
There's definitely not. I mean, I don't think I have ADHD or anything like that, but I will say that these freaking cell phones have really made me think I have it, because I will open my phone with the intention of doing something like a legitimate task, and then notifications on the screen, and I like jump over to Instagram or whatever it is, and I'm like, why did I go into my phone? It's just like walking into the kitchen and not knowing why you're there, but it happens all the time, and it's infuriating.
It is infuriating. Yeah, the phone can be a big distraction, especially for people with ADHD. It's like,
so, okay, question for you. You said something that I couldn't quite figure out if maybe there's been another life change, or if I just misunderstood. Are you still working as a labor and delivery nurse?
I am. Yes, I am. That is not a change. Yes, I definitely am. I still work the same amount. I'm still, once every 2 weeks. So I do like twice a month where I'm there. But yeah, I think I said when I was nursing, but I am still nursing. But I meant like when I was just doing bedside work. It's like I never had the autonomy with being a nurse. Like there's not a degree of like having things that you have to do and being able to pick and choose. I don't know, to a degree there is like picking and choosing which one is the most important thing to do now. But with nursing, it's very different because it's like very clear, what takes priority. Like if my patient is, saying they can't breathe, okay, that obviously takes priority over, giving this other person medication, or like, it's just very obvious. It's not like a desk job where you have things that you have to do in front of you and you can just get very distracted, and it's not, life altering if you don't do them. Like in nursing, it's, you just are kind of just like always on. So I've never really had that pressure in my career before. But yeah, definitely still bedside nursing.
Okay, so you're only going in once every couple of weeks, basically. For whatever reason, I just got it in my head that you were part-time, so I was picturing you there about 2 days a week. And when I see you on Instagram and doing all the things you do, I'm like, how in the freaking world does she do this?
No, that is
what I thought.
Yeah, no, that is how I do it. Is that I don't work very much. I think in the beginning, because that's how I was when I started Mommy Labor Nurse, is I was part-time, and I think people do it like that because they're very driven and it's their passion, and you get really, I mean, you get burnout eventually. But yeah, that's how I do it, is that I have a balance. There's no way that I could work, because this is my, I work full time. Like this is my Monday through Friday job, and then on the weekends, every other weekend I do like a weekend shift, or that's how I do it. I don't.
Yeah, I mean, and also you've had it looks to me like you've had a lot of growth in the past year as well. I mean, you're already, when I met you a year and a half, 2 years ago now, you were already quite popular. But it's already grown so much. And
it has.
Is it your sister that's working with you?
Yeah, I have 4 other people who work for me, actually. So it's me. Yeah, so it's me. My sister she does like affiliate stuff, and she is my assistant. She does affiliate stuff. She does like the design kind of stuff. And then I have a content writer, and then I have Tiffany, who's, she does a lot of other things, and Claire helps with DMs and customer service. And we have, it's a nice little, I mean, I love it. Like, it's great working with a bunch of girls. And two of them, like Tiffany and Claire, are both nurses, and it's definitely grown. And just the things, I think we've grown, but we've also just like gotten smarter with what we're putting our focus into. 'Cause I haven't had, I mean, this even goes back to like the ADHD. I haven't had, like, I get really, really excited about something and I can do it really, really well. But sometimes I I get lost in translation. So Tiffany's very analytical and she keeps me very straight. And I mean, we work very, very well together because of that, because she's very not ADHD at all. And I'm very much the creative brain. But yeah, definitely have grown in the past year, which is fun. It's just really fun to be a part of it.
And so at this point, your, twice monthly, more or less, L&D shifts, would you say that you're doing them because you just truly love being at the bedside? You're not willing to let that piece go. You don't want to lose your skills. Like, what is it that motivates you at this point?
Yeah. It's funny, Tanya, because there's a part of me where I'm like, when is there going to be that day when I'm like, you know what, like this gives me way more passion than bedside nursing does. And I've struggled with that over the past year because it's starting to turn. Now I'm just able to do so much more, with mommy labor nurse stuff. But I'll think about those thoughts and then I'll go into a shift and I'll like take care of a really cool patient or have a really cool experience. And I'm like, not quite ready yet. Like, this is still pretty cool.
And I would imagine that it serves as a source of keeping ideas flowing
Yes.
for
Yes.
mommy labor nurse. Because I know that for myself, like, all right, I'm practicing clinically other than the virtual stuff, which I'm doing every day, of course, and that is clinical, but I'm not at the bedside anymore.
Yeah.
And I know that sometimes I go to webinars and other things, even if I don't feel like I need to learn that content, I think I already know it, but I'm just like looking to expand my mind to keep the ideas flowing of what is it that people need to hear? What is it that people need to learn? Because sometimes you can feel overwhelmed by this endless job of sharing information and not knowing how to get focused. So it's interesting to hear you talk about that too.
No, yeah, definitely being at the bedside helps me stay relevant, I think.
Yeah,
I think
totally.
so.
Okay, so I have a question. Do your clients in the hospital already know who you are? Are they like weirdly starstruck? Like, what's happening there?
I've had that happen a few times, but it's not definitely not every shift. Like I much more have that happen in like passing by. So like I'll come to work and one of my coworkers will be like, "Oh, I had a patient the other day who took your course and she did really well, and she was asking if you were here." Like that happens all the time. But my actual patients where I walk into the room, they're like, "Oh, wait, I think I follow you." That's happened, I think, 2 or 3 times. And now with COVID, we're kind of like, you can't really recognize people. And my name's, pretty recognizable, but sometimes people even follow me and they don't know my name because they just know me as mommy labor nurse. So I'm sure that I've had patients that probably follow me, but they like just don't put 2 and 2 together. And maybe afterwards they do. But yeah, I have had it happen a few times where a patient, I like walked into the room and she was like, "Wait a second, I think do you do that thing?" And then I had a patient where she like requested me because she knew, like, she was like asking the night nurse if I was on shift, and I she got lucky, like I was, and then she requested me and I took care of her. But yeah, it doesn't happen, like, it definitely doesn't happen every shift.
Are your coworkers like, "Oh God, a mommy labor nurse"? It's like all the time.
No, no. I mean, maybe they are and they just don't tell me, but I think most of my coworkers are pretty supportive and they are mommy labor nurse fan. Like my one coworker, I was there and she was like, I love Sundays. You do story questions. It's just my entertainment for my Sunday." I was
That's
like,
awesome.
"Oh, thanks."
I love it. That's great. Okay, so your production value is what I've noticed the biggest evolution in over the past year. And there's 2 main factors, right? There's like Liesel's doing a lot of acting these days, which is really adorable.
I am. Well, actress, yeah.
And your sister too, right? There's just like
yes.
all these fake bellies floating around doing silly stuff.
Yes.
It's kind of fun. But the other thing I'm really digging is what you do with Barbie dolls. And I actually screenshotted something because I have to ask you. Well, first, I'm going to ask the easy question. What do you stuff the Barbie doll with to be pregnant?
Oh, okay. Here, I have one right here. It's let's see.
I figured it was a little ball of Play-Doh, actually.
No, it's not. That's a pretty good idea. No, I have 2. So this one has a fake, it's like a Barbie doll fake belly. Okay. So
Oh,
like I
wow.
just kind of put it underneath her shirt.
Where
She's
did
wearing
you
kind of
get
a
a
tight,
Barbie doll fake belly?
actually one of my coworkers texted me and she was like, I have a pregnant Barbie. Do you want it? And I was like, yeah. So I got it from her. I have no idea where she got it. I don't know if they make these anymore. But yeah, that's one. And then let me find, I don't know where the other one is, but the other one is, what I did was I took an Easter egg and I took like half of the Easter egg and I like put it underneath her shirt and I like taped it to her. And that was my go-to before I had this thing. And this thing's a little bit more, I feel like, realistic on the Barbies, if you can even get
Yeah, no, I
realistic.
can
But
see it. It looks great. I mean, our
yeah,
listeners can't see it, but I can see it.
yeah.
Okay, so the one that really got me, I'm going to see if you can see this one for our listeners.
Okay.
It is a post called Epidural Tip. And oh, I screenshotted it, so I don't know what date it was, but it's not from that long ago. It's got a mom laying in a bed, side lying with something between her legs, like as
Yeah.
if it's a peanut ball or
Oh
peanut
yeah.
butter, but I don't know what in the world that is.
Oh,
What?
I have it. I have it over there. It's my son's football. It's like a little inflatable football.
Oh my God, I'm
I
like
know.
blowing the screen up going, is it a diaphragm from a blood pressure cuff? Like
Yeah.
I was thinking all kinds of images to try
I
to
gotta get
figure out what it was.
creative. I gotta get creative. It was actually pretty easy. Like when I do miss that element of being at my parents' house taking pictures because my parents they have so much just random little toys or just like little things. So I used to get a lot of like just creative energy from that. And I have boys, so I don't have girls, so I don't have like all of the kind of like Barbie accessories. But yeah, that was just a little inflatable clear football that my son had. I don't even know where it came from, but yeah, that's what I used as a
Yes,
little
that's what
football.
amuses me, right? Because like I don't need the
Yeah.
content for educational purposes, but I really get such a kick out of looking at the Barbie doll photos and trying to figure out what you're using
It's
for
fun.
props.
Thank you. Thank you. I'm glad that you appreciate that because it does take some mental work to kind of figure out how am I going to make this look this way?
I know that's what I'm like. I don't have the mental space for that kind of thing. Like I will never do Instagram like you. I will never do the thing. I just don't have it in me to do it. So that's what finally led me to start a podcast, right? Because I was like, I can't,
Yeah.
this Instagram thing, honestly, it's just not for me. I don't mind perusing Instagram and following
Yeah.
people, but like making content, just not my favorite
It's
thing
hard.
to do.
It's harder than people think it is,
It is. And things,
especially now.
yeah. Well, thankfully now it's funny listening to you talk about the team that you've built. I, for the first time, have two people helping me. And it
Yay.
is so pleasurable to have
Yeah.
people around and not be alone. So I have a
Yeah.
college student intern who is slowly going to take the reins on social media, which is like, what a gift.
Oh, that's
And
great.
I've got somebody doing editorial work for me and writing really awesome blog posts and just kind of doing all kinds of stuff behind the scenes. And they're just, they're giving me so much strength.
That's so great. That's so great. That is actually whenever I go on business podcasts, that's always my best piece of business advice is like if and when you can hire out, do it.
Yeah.
Because I think people take on too much and then we all do it, as entrepreneurs, like we all start and then you get overwhelmed, you get burnt out. And yeah, it really takes like that's how you scale and you get to the next level is you realize when you need help. And I basically look at it like this is what I tell like what do you call them, solo entrepreneurs or whatever. Hire out anything, obviously, if you have the financial means to, but hire out anything that you can't use your face or your brain to do. Okay, so like somebody else cannot record my podcast episodes because I need my voice for that, right? But somebody else can write my intros for my podcast or write me an outline for a podcast episode or write my blog articles or write my captions or do my books or do like all of these things that I really don't need my face or my brain for. Like I need my face on Instagram, and in my stories, but somebody else can like edit text onto my stories. So if you break it down like that, you can really get a lot done. And yeah, time is like value your time really more than anything. Like time is so like if you that's what we've been trying to focus on in the past year is like how can we do more in less time?
Yeah. Yeah. And I'm so at the very tip of learning how to delegate that it's going to be another year or two before I come back to you and say, I have
It's
learned
hard.
some of the lessons that you were trying to talk
Get it?
about.
Yeah. Yeah. Get it.
Okay. So what would you say is your favorite part of doing and being mommy labor nurse? And likewise, what is your least favorite part?
My favorite part. I mean, I right now I'm really really into creating content and I love making my reels. Like I just love browsing through different sounds that are on there and getting ideas and just recording them. And I mean, I just make myself laugh. Like I just recorded one the other day where it was like things that labor and delivery nurses oh, yeah, things that labor and delivery nurses love to hear. And it was just this funny sound of somebody going, ooh, ah, and it was like I have to poop or I feel pressure down there or the baby is coming, and I just did it in a really funny way. I don't know, I just cracked myself up. So I just love to record my reels and edit them, and I love when they do well and people actually like get my humor. I'd say my least favorite part is I'm still kind of sensitive. So I mean, I hate the I still get, negative DMs or like negative comments or people just, not being very nice. And I've gotten very like away from that because I have somebody else who's like commenting back to people and in DMs, but every once in a while I'll see that stuff and it'll get to me. But yeah, that's probably my least fit. I don't have a lot of it. Like my community is pretty positive and I've built a pretty good like community. We don't talk about a lot of like super controversial kind of stuff, but I keep it light and educational and fun. And I mean, that's what I've always wanted it to be. So I feel like I've built a pretty cool community, but you still, especially if I get one that goes really viral and then it gets a lot of people who haven't been following me, then you'll get some negative comments. But yeah, I mean, it's just to be expected with all of it.
Yeah, you can't have a following the size that you have and not
You
have
can't.
some bad eggs. It just can't happen.
Exactly.
But it's
Exactly.
funny hearing you talk about it because I know that I spend a lot of time just being worried about saying
Yeah.
something the wrong way or
Yeah.
how something will be perceived. And there's a lot of stuff that I take off the table, probably just out of some sense of fear. Like I don't feel prepared enough at this point to take some certain risks. And that's something
Yeah.
I'm obviously going to have to deal with. But
Yeah.
I've tried to find that happy medium for myself at this moment, but it's obviously going to evolve a lot over time.
Yeah.
Okay, so same question about podcasting. What is your
Yeah.
favorite and least favorite part?
Of podcasting. So, I mean I love recording with my guests. Like that's one of my favorite things to do, whether I'm coming onto a podcast or I'm recording with somebody. My least favorite part is the planning process and the logistics. And now I have somebody who's really helping me with that. So I don't have to do that as much anymore because I get really just very, just sidetracked and I'll kind of go on a tangent about one thing, but I love getting into a really deep subject. Even my solo episodes, I'll love if I'm in a really, really, deep, really deep subject and really trying to explain it like super thoroughly. And that's really the reason that I started the podcast is because you can only do so much on Instagram, and podcasts are great because you get to really talk, like I get to really talk about VBACs or, whatever it may be, some subject. I mean, the Instagram captions only have so much, like so many characters that you can put in your Instagram caption, and stories are only 15 seconds long. So it's like I can't really dive into a subject if I want to. So I love the podcast because I'm really able to elaborate on certain subjects. And I just love having people on and just, podcasting, honestly, it's a really, really cool way to connect with people too, and just really, really great for marketing, or sorry, not marketing, yes, but networking with people. So yeah, it's been fun. That's probably my favorite part is just networking with people and getting to know people. Like asking them, sometimes it's like asking them questions after the episode of like, hey, how are you doing this? Or like what, like there are just like weird questions that I'll have. I'm not going to say anybody out loud, but I'll have a guest on and my team and I'll be talking about them before the episode. And they're like, make sure you ask them that in a strategic way. And I'm like, oh yeah, you're right. Okay, I'm going to ask them that. And then you could ask them kind of like after the episode, because you're you kind of like, you talk to them for an hour and it's like, I can ask you this question. But yeah, it's fun. I mean, I love talking and I just love talking to other people. So that's definitely my favorite part.
Yeah, I mean, I decided to do this. I mean, the decision was almost a split second decision,
Yeah.
but it came out of a series of conversations I was having with a very dear friend who I was complaining about Instagram for myself, not
Yeah.
other people, like the role I want to play. I don't have a real desire to put my face out there over and over again. I don't have a desire to make videos. Like, it's just not what I want to do. Anyway, I was being really negative, like overly negative in this conversation. And he was trying to like talk me down from the ledge. And he was also trying to tell me that basically I was being too negative. And message was taken. It took a little bit of time, but basically I came around to this place where I was like, I can't summarize for Instagram what I do with and for people. And I think you know that as well as, or better than many people.
Yeah.
There's no tagline that explains what I do. There's no quick 15-second, this is what I do. I can't figure it out. I have spent a year really intensely trying to figure out if I could figure that piece out, and I can't. And in my inability to do so, I had this moment where I was like, podcasting, it's long form. It's my opportunity to just let people find me when and where they find me, let former clients tell the story, let other professionals come on and have great conversations with them and show people who you are, because it's the only way I'm going to get the word out there that people need a certain kind of support and more support in all the ways that I don't think there's enough of us out there doing.
Yeah, and you do it so well too. Like you're lovely. I mean, you're lovely to listen to. So podcasting comes very naturally to those types of people, like Instagram. I mean, I feel like I'm pretty lovely to listen to, but I mean, people like I guess people like my acting skills, and I just like being in front of a camera. And yeah, Instagram's definitely harder if you're not like super gung ho, love being in front of that camera.
Yeah.
People love faces on Instagram.
And, it's ironic because I did go to performing arts high school, and there was a time in my life when I was all about performing, but I'm not joking. The second I decided I wanted to be a midwife, I feel like I have a split personality. That part of me disappeared.
Yeah.
The only remnant of that old life for me that I can even conjure up is that when I am one-on-one with clients, whether it's been many years in the office, explaining things to people, talking people through procedures on labor and delivery, or even in virtual visits, talking about stuff about postpartum care.
Yeah.
I know that I have a way of like deciding how I'm going to deliver something so that it hits at the right moment, hits the right way. It's definitely something I spend energy thinking about. And I know on some level, this comes from this old part of me that was a kid who wanted to be an actor, but like, don't want to stand on a stage, don't want to be in front of a camera.
Yeah. No, I get that, because in a lot of ways I was like that kid too. And I loved to perform, but I hated the like pressure feeling of it, and like I never really wanted to be on TV or in movies or anything like that, because it's like I hated that part of it, but I still love to perform. And that's why I love Instagram, because like I can kind of do it on my own time and I can decide what I'm saying and like how fast I say it, or if I need to take another take on my stories, or how I'm doing it's different. But yeah, I get that for sure.
Awesome. So what's in store for you kind of personally and professionally moving forward that you can see?
Yeah. So professionally, this year, we're really going to focus more on growth. Last year, we really focused. I mean, we inevitably had growth throughout last year, but we really focused on updating our courses last year and getting them like perfectly pristine, with a little bow on top. And now our courses are great. We're really, really proud of them. And we have a great weekly pregnancy series for people to go into, and we're updating that more. But yeah, we're really going to focus on growth and just trying to get the word out more on, maybe on TV or maybe, somewhere else. I can't really spill too much, but yeah, that's definitely we just had our kickoff meeting a couple weeks ago, and that's really the main thing that we talked about is like, okay, how do we have all of our products we're good there. How do we just expand our network, as much as we possibly can? So that's really what we're putting our focus into this year.
Well, I don't know what you're conjuring up exactly, but when you said TV, I instantly saw you with a series on TLC, for what it's worth.
Oh, well, that would be fun. I mean, I don't know if that's going to happen, but, it'd be cool to get on like Good Morning America and just like some news shows and tell people about mommy labor nurse. I mean, it's interesting now in these days, these COVID days. Yeah, it would be cool to really get the word out about online birth education, just online birth everything, because it's so accessible, especially now with COVID. So yeah, we're really going to try and really get the word out more. Personally, I think I'm just going to, I'm going to try that thing where you, first of all, I'm going to read this book. Second of all, I'm going to try the journaling, like brain spill, and like you said, not to read back what the words say, right? Just do it. But that's interesting. But yeah, I think personally, I'm just going to continue on this self-exploration that I've been in. I don't know. I really want to get a tattoo, which is random. I don't have any tattoos, but I've really been compelled in the past like month or two to like get a tattoo. So I think I might do that. That's random, but yeah. It'll be a fun year, I think. I'm excited.
Are you going to have more kids, or are you done having kids, do you think?
I think I'm done. I mean, I don't know if like, I have an IUD in now. So if something malfunctions, then so be it. But I don't have any plans to take it out. I think I'm pretty content with my two little dudes, but
I just realized that the vibe I'm getting from you with this self-care and then the tattoo feels like someone who's coming back into herself.
Dude, yeah, that's me. That's me.
That's so where you're at. And it's actually so well timed, right? You have a 1.5-year-old and a 5-year-old. Yeah. You're recognizing that your family is complete, which, I remember talking about this with you guys a bit as we were wrapping up in your care. That was getting to be a while ago now, but it's so nice to see that happening, because I can see like you blossoming into this new adult version of yourself where your family's complete, and it's so obvious and really beautiful.
It's fun. It's exciting. I'm like, I'm me again. This is me, guys. Like I'm not, crazy sleep deprived Liesel that I've been for the past few years. Like
I would argue it's new and improved, because I believe very firmly, and we've talked about this on a number of episodes of my podcast, because I tend to attract a certain kind of person. I'm learning also. That's another, like almost everyone describes themselves as type A, and I'm trying to be prepared / over prepared, right? There's a certain personality that comes my way. And in that, I'm seeing a lot of people that really just discover their best selves once they're out of the woods. And I'm seeing it with you too, which is so super cool.
I know. I'm excited. I mean, it feels exciting to really put yourself first again, because I didn't really understand. I always, you always say that, like, oh, yeah, I'm gonna still brush my teeth and, well, whatever, take a shower. But it's like I never really understood what self-care meant. I always said, yeah, let me do some self-care, but I'm realizing that like this morning routine that I'm putting in place, the thinking about getting a tattoo, or just doing things that I actually want to do, and acting on more of like, I want to do this versus I should do this. Like some mornings I'm like, I should probably get on the Peloton. And other mornings I'm like, I want to do some yoga. So I'm like, I'm doing what I want to do. Okay. If I want to get on my Peloton, I can get on my Peloton, but I should never do, I mean, there's obviously things in your life that you should do them and you have to do them. Like, taking care of my kids. I mean, I want to take care of my kids, let's be clear. But, there's just some things in life that fall into that category. But I'm realizing that it's more about, like, you really have a lot of choices in life. And to go more towards the want versus the should, you're going to be a lot happier. So, yeah, it's exciting. So my tattoo that I want to get, like, MLN on I don't have any tattoos, but I want to get MLN just on my arm because go ahead.
I was going to ask you if the tattoo in mind was somehow labor nurse oriented. It makes sense that it would be, but.
Oh yeah. And it's interesting, Tanya, because I had this really deep feeling right after I had Ryland that I'm like, my journey is not complete. Like he is my second child. He is not my last child. Like there is just something out there. And who knows, like there might be a third child. Let's be clear. Like things do happen, crazy things do happen, but I'm kind of realizing that like my third child, it has always been here. And my third child is mommy labor nurse. I mean, let's be clear. Like that's my third child. So yeah, I mean, I have a feeling I'm the kind of person that if I like really get into something, then I like really get into it. So I have a feeling I'm going to get my first tattoo and then be like, oh, let's get another one. But yeah, I'll check back in with you on that because I am still a little bit nervous about it. Just the whole, you got to wrap your head around it, right? So yeah, I'll check back in with you on that in a few months. Hopefully we've
on
that path.
I hope I get a little picture.
I'll send you a picture. You know what, Tanya? I will once I do that, you'll be the first.
Okay, I love it. I am so happy that we got a chance to catch up and just chat and
yes, I love it.
And it also felt really good because out of the 12 episodes I've recorded, this is like the only one that was just like super chill and having a public conversation with someone. And I wanted to know what that felt like. And you felt like the right person to do it with. So thank you for giving me this chance to, try a new thing on my podcast.
I am honored to be here, Tanya. I'm always down to come and chat with you whenever. So
thanks so much, Liesel.
Thanks for having me on.
Bye.
Hey everyone, it's me, Tanya, your host here at the Mother Wit Podcast. You know I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.